Welcome everyone to another wonderful episode here, just Podiatry. Try not to laugh. Case update. I recently uploaded a video. This young gentleman's foot, his partial toe is at risk for loss. We know that. The good news, I'm seeing a very robust change in the appearance of the ulceration. You guys will recognize the foot once I show everyone the visual. Let's show the visual first, okay? So he had a huge callus, and we debrided everything. When we uploaded the video, I don't know if you guys recall, the tissue here was gray. A lot of people were commenting that it was gray. And then, of course, he has an element. We all know that he has an element of, vascular compromise, microvascular issues, macrovascular issues. And our goal here is, of course, to save the partial, the rest of the toe. Right, this was a partial amputation. So what we're going to go ahead and do today, without further ado, I said, you know what? Let's give this a turbo boost. And what we're going to go ahead, the patient has agreed to be shown in front of the camera. Thank you very much. We are going to harness, right, and isolate the patient's platelet-rich plasma. I'm going to take you guys step by step. So first, again, PRP, and we'll go ahead and I'll draw everything on the whiteboard. PRP, platelet-rich plasma. We're drawing the blood. Step one, we're going to isolate. Once we draw the blood, we're going to centrifuge that blood several times. We're going to extract the plasma, which is also known as what we call the liquid gold. Contains the growth factors, important cells that aid in the regeneration of damaged tissue, reduces inflammation. What is an ulceration? Inflammation. And then we'll go ahead and draw everything out so you guys really understand the physiology of how this works. So come around here. Okay, the first thing is we're going to draw the blood. I see a good pipe right here. Hopefully, he's diabetic. Usually diabetics have scorpion. Oops. Okay. So we're going to go ahead and, don't worry, my friend. This is my first time drawing blood. Okay?
That's all right.
Así. Ahí mismito. 1, 2, y 3. Here we go. Okay, and there it goes. So we're drawing blood. Okay. And then we're only going to draw, we'll use 2 tubes only, just because I know exactly, depending on the clinical presentation, what we need. And again, we have a 4x4. Okay, thank you very much, sir. And a 1, 2, 3, and we're done. Okay, now you do this.
Mm-hmm.
So basically, what we're gonna go ahead, Melissa's gonna go out. This is how it works. Okay. We'll just say this is bone. Bone. Even though they're a little bit separated, we'll just kind of just leave it like that. what we are preventing now is an opening here, because then the bacteria, right, we'll just kind of go like this, right? The little bacteria will go and inoculate the bone. That would not be good, because that will be equal, sorry about this, bone infection. And that means more amputation. Okay? So we are preventing amputation. Today, ulcer. You may believe these are little roots, right? We're gonna come from underneath these roots, underneath the ulcer, and infiltrate the PRP all around the ulceration and even into the ulceration. We're delivering all these goodies. And this is going to provide the oomph that the ulcer needs. The fact that it's tuna sashimi red tells me that there is enough blood supply reaching the ulcer, which is great. Mm-hmm. Because no blood, no healing. But this is what we want to do. Come from underneath. It's a technique that I've used for many, many years. And, I don't care what people say. Oh, the ulcer, even if you don't do this, it'll probably heal. I frankly don't care. I really don't. What I do care is the patients that are under my care, that we close the ulcer as quickly as possible to avoid worst case complication. Okay, so come with me. Let's go check out to see. I'm going to show you guys, what we're doing now. Okay, so basically, centrifuge, blood is spinning. It'll be spinning for a while, then we'll respin again. And what we're essentially, like I said, what we're essentially trying to do is take, all this blood, the whole blood, and we're squeezing the PRP out. Separates it to good and bad. So once what we're gonna do is we're gonna put a little stop when I tell you, and then we'll pick it up, and I'll show you guys right before we take it out, so you guys see how it separates. And after that, we'll isolate. Boom. And then I may put a little dermal graft on that, and then by next week, I think that you guys are gonna see the proof in the pudding. Stand by. Okay. The saga continues. Please show the world here. So what we have here, we had the whole blood, spun it. It has already separated. The bottom part is the whole blood, right? The blood, the bad part. And then the top, we have the platelet-rich plasma. We're not going to get into the different components, but there's actually something called PPP, which is the poor platelet plasma. We're going for the rich, not the poor. So Melissa's going to go ahead and draw up the the platelet rich, not the platelet poor. Okay, so it's really important that we draw. We go all the way to the bottom, very close to the bad stuff, believe it or not. Okay, follow me now. So she'll continue. And now what we're going to go ahead and do is... Tú no tienes ningún tipo de sensación en los pies. Nada.
En mitad del pie, sí, pero del tercer dedo para arriba es poco lo que siento.
Okay, so I basically asked the patient, do you feel anything at all? Do you have any sensation? Because we all know, for the people that have seen some of the other videos on PRP could be quite uncomfortable. The $1 million question is, does he need anesthesia local?
I don't think so.
I don't think so either.
You can try. Yeah.
He has probably severe diabetic neuropathy, and I don't think we're going to need. So the first thing that we're going to do is perform a very old procedure, technique. We'll debride it a little bit. Go ahead and just use a little 10 blade. Again, I did this the other day. We crosshatch, looking for that blood. Crosshatch, tic-tac-toe, right? Dr. Wagner, why are we doing this? Why would you be doing such a thing? Why? Because we want to wake up the cells that are sleeping. That's why. Crosshatching. Liquid gold. That's why it's called liquid gold. The color. Okay. So now what I'm going to do is I'm going to come from underneath. Okay.
This is Lido and this is the other liquid.
So in this particular case, I want a. Let me have a pair of gloves, goggles, please, for Caesar. Just in case, because sometimes when I start infiltrating the PRP, we may get a little squirt here. Sometimes, I'm not saying that's going to happen, but to protect everyone here, especially Caesar, who's in front there. Let's put a pair of goggles there. Okay, super. Okay, so we're going to come in through here. Okay. We're underneath, remember, and slowly. Again, I'm gonna try to show as much as I can. I don't want nothing squirting at anyone's face. Okay, do you see there? Okay, so I'll put it right up here just in case. And we're just infiltrating. Okay, not a lot, right? I'm gonna come around here. On the top now, around the periphery, put a little bit there as well. Let's go over here now. Sorry about that, I just want to make sure nothing squirts anywhere. See, just like that. Okay, I'm gonna go, come behind me, Caesar. Then we're gonna come in through here. So, isn't it incredible? No anesthesia. This is what diabetes does. You good there?
Mm-hmm.
We're done. Now, I'm going to put this down here very carefully. And I have a cellular matrix. Okay, this is a cellular matrix that I'm going to apply. Okay. And what we're going to go ahead and do is I'm going to change my gloves. 1 second. And this is actually, this matrix is actually from the urinary bladder of the pig. And we're going to apply that on the ulcer. So what I'm going to do is I'm going to trim We'll put a little one here, kind of like that. And then we're going to put our other one here. Okay, that's a beauty. And now we're going to take our other syringe, liquid gold, and I'm going to just carefully spritz it. You see how the graft is absorbing? It's changing from white. See that? This is definitely an art. When we talk about saving limbs, saving lives, it's not just, hey, let me just slap this on, right? If this was my family member, this is what I would want. Give me a second. Let me close the door a second.
922-73.
So if this was my family member, this is what I would want. Okay. Put that there. Take a little piece of non-stick. We'll lay that right on the top, just like that. Okay. And then we'll put a dressing now on.
I got a question.
Please.
The first thing that you put in there, those two little pieces, that's like artificial skin?
See, it's he's asking if it's artificial skin. It's derived from the urinary bladder of the pig.
Mm-hmm. I mean, I gotta be running like a pig. I'm sorry about that. I'm sorry. to say.
No, you're gonna, these days we have the good fortune, and I can name, not only in, in the wonderful world of wound care, there's so many different, products out there, even, from different animals, from different places, from humans, from the amniotic membrane, from a lot of different locations.
Wow.
So we do have the good fortune of living in a time where we have all these resources available.
That's an amazing.
It's amazing for sure.
Yes. So you're doing a good job. You're there. Yes.
I will keep this this young man. I will keep everyone afloat on this young man's progress. As always, www.jawspodiatry.com, Instagram, Dr. Tojam, Jaws Podiatry, Facebook, and last but not least, our YouTube channel, Jaws Healthcare. Stay safe.